chronic pain. So a little bit about me. Right now I'm a licensed sophomore at UC Berkeley. I'm intended in molecular cell biology major. As of this year, I've become a licensed EMT phlebotomist, and I've been volunteering since high school, and right now I'm volunteering in a clinic. So first of all, let's talk about what chronic pain is. Chronic pain is pain lasting longer than 3 months or beyond the normal healing time. And it's actually quite common. It affects over 50 million adults in the US. Some types are neuropathic, which is nerve damage, nociceptive, idiopathic, which is unknown cause, as well as musculoskeletal or inflammatory, which can result from autoimmune conditions such as rheumatoid arthritis. Chronic pain is more than just a symptom, it is a condition. Because people who have to deal with chronic pain, it is very taxing on them, physically and psychologically. So some causes of chronic pain are injury or surgery, diseases such as arthritis, fibromyalgia, which is described as widespread pain. We don't understand the causes of it just yet, and it can be triggered by physical or psychological stress, as well as cancer. Nerve damage can result from, let's say, diabetic neuropathy, which is the result of high blood sugar leading to nerve damage. That can be done because when the blood sugar is too high, that can result in oxidative stress, which is essentially an increased production of reactive oxygen species, such as superoxides and radicals, which are very reactive, as well as glucose non-enzymatically binding to proteins and lipids, which can affect their structure and function. And finally, there are psychosocial factors such as stress and trauma. Some current medications we have are non-steroidal anti-inflammatory drugs. Non-steroidal refers to drugs that are not like corticosteroids. Corticosteroids they mimic the effect of cortisol, which is synthesized by the adrenal cortex. There's also acetaminophen, which people generally know as Tylenol. There are antidepressants, anticonvulsants, such as gabapentin, and opioids, which are reserved for more severe cases because opioids can be addictive. Some examples can be Vicodin, also known as oxycodone, or a very potent cough medicine known as codeine is also prescribed in the worst cases. There are also non-medication therapies because, as we'll get into later in the presentation, it is very, very difficult to treat chronic pain. So there is physical therapy, occupational therapy, which helps people become more able to do everyday tasks, cognitive behavioral therapy, which is still considered the gold standard in terms of psychological treatment, and mindfulness and relaxation techniques. Some interventional treatments we have right now are nerve blocks and injections, where they inject medicine near nerves to sort of disable or affect how the pain signaling happens. There's also spinal cord stimulation for pretty bad cases, where they will insert a device under the skin near the spinal cord, and there are leads or electrodes that go into the epidural space, and they send signals that disrupt pain signaling into the spinal cord, which in some older devices, they turn painful stimuli into paresthesia, which is known as tingling, essentially. And in newer devices they've been working on, they've been trying to reduce this pain to no sensation at all. And for specific cases where the source of pain is more well known, or where the doctors have been able to pinpoint what it is, there have been surgery and it has been somewhat effective. And because chronic pain is such a tough thing to treat, it's more than it goes beyond just medications and treatments, because dealing with chronic pain also is very taxing on the person. So it is important that they are supported in their lifestyle. So there's exercise and movement therapy, nutrition and anti-inflammatory diets, support groups, and peer counseling, sleep hygiene, and stress reduction. So pain is very subjective and hard to measure because it can present differently in different people. For example, a heart attack generally presents as pain on the left side of the chest, pressure, and radiates But that can depend on the person. Sometimes people don't feel much pain or it radiates to other places. So you can't really tell exactly what's going on because people feel different things. And chronic pain also has long-lasting issues because it is hard for people who need help to get treatment, especially because of the opioid epidemic. People have started to become, some people have become addicted to opioids, and doctors have become more mistrusting. And as a result, they try to ward off people who show drug-seeking behaviors, and that results in underdiagnosis and chronic pain patients being shrugged off, so they don't receive the standard of care they deserve. And because of this, people who need help are limited, their access is limited to that. And it's also pretty hard for them to get multidisciplinary care, so they can get treatment and lifestyle support, physical therapy, etc. So most of the challenge of chronic pain is actually due to our lack of understanding. Pain is very, very general, but we put it under an umbrella term of basically pain that lasts. Normally people see pain as something that goes away when you scrape yourself and you cut yourself, you don't have to worry about it, because it goes away, but we don't really understand what exactly causes this pain to stay for such a long time. Oftentimes when it goes away, it can go away on its own, and that's why we have been doing new research to point us towards a future direction, so we have a better understanding, so we can better target the problems people face. Some examples are neuromodulation advances, where we are trying to understand or better track the pain signaling. That's why, for example, we take a piece of spinal cord and try to see exactly how the pain signaling happens, so we can develop better drugs or develop new medications to target certain receptors that can affect, or develop new medications that have more specificity. Because when you take a new medication, it can have lots of side effects, and that's what also makes it very difficult for people to take medications and switch medications when they don't work. And that's what adds a lot of stress. So if we can figure out a more specific medicine and understand how this works better, we can have our therapies be more effective with less drawbacks. There have also been research into regenerative medicine. Stem cell therapy is pretty big. Basically, stem cells can differentiate into a whole lot of cells, which can help our tissues regenerate. And that has shown quite a bit of promise, as well as platelet-rich plasma. That's essentially the plasma is a liquid component of your body, and platelets they promote a lot of tissue regrowth, so that's why when they basically draw your blood and they draw it into a tube of anticoagulant so that you can get plasma instead of serum. And this plasma is concentrated and injected into the tissues that feel chronic pain, so you can, in an attempt to sort of help that area regenerate, and that's also shown some promise. We've also been doing genetic research to have more personalized data because certain conditions like fibromyalgia have been shown to have genetic causes. So, yeah, there's that. And also, artificial intelligence is also on everybody's radar right now, I'm pretty sure. But we can also use it to predict treatment responses and pain patterns. And finally, we are looking into medical cannabis and psychedelics. Now, these substances, psychedelics, they're not very well researched because they're a controlled substance, but these days there have been a lot more research on it as an alternative to opioids, because opioids are shown to be a bit addictive, so we want to try to find some more medications for them. So some conclusions to take away from this is that chronic pain is complex and multifaceted. There is no one-size-fits-all treatment, as it can present differently in different people, so it is important to approach it from multiple different directions. And while we don't understand chronic pain very well right now, our research is showing promise as we are developing more specific treatments. And it is important to support these people through their healing journey. If you have any questions, you may ask.
What do you think about the movement to legalize psychedelics in relationship of chronic pain research?
Well, I think it shows promise because opioids have been shown to be a big problem, and it's just antibiotics. We need a new class of them, right? It's like the last time we discovered a new class of antibiotics was in the 1980s. So it'd be nice if we discovered new things that people can use, because different drugs have different effects on people. So like one drug may work on somebody, but it might not work on somebody else. So people often try lots and lots of drugs to find something that works for them. And if you have more options, that's obviously pretty good. We don't understand much about psychedelics right now, but perhaps if we understand more about it, we can use them in the treatment of chronic pain. Anything else?
You mentioned genetic therapy as upcoming area of research. Have specific genes been found that lead to chronic pain?
Not that I know of. I'm not very well known on a specific gene, but they're definitely looking into like sequencing and trying to find certain genes that lead people predisposed to conditions like fibromyalgia.
Thank you.
All right, and that'll be it then. Thank you.